Hi, this is Dr. Barry Leica, host of Inside Cosmetic Surgery Today on WebTalk Radio. This show is all about the newest and best in cosmetic surgery, things that you need to know, things you won't find anywhere else. Well, today I'm talking with my good friend Bruce Katz from New York City. He's Mount Sinai School of Medicine Director, Juva Skin and Laser Center Director, and Cosmetic and Laser Surgery Clinic, one of the biggest in New York City. And Bruce has been on the show before. He always brings the newest and best toys. Today we're going to talk a little bit about tattoo removal and some of the new things he's doing in that. Hello, Bruce.
Barry, thank you very much for inviting me. Delighted to be back.
Yeah, it's great to have you. You know, we're now getting thousands and thousands listening to the show every week. It's amazing how many people are catching on to it. And I think it's one of the top radio shows in Canada and the United States on the skin, on beauty, on the things that we can do with cosmetic surgery. Well, tell me, what is new in tattoo removal in New York City?
Well, you know, there really hasn't been a major advance in tattoo removal in about 20 years, Barry. And for the first time in 20 years, we really have something new and exciting. And it's called the PicoSure laser. It's actually a new type of laser with a pulse duration, with the time that the pulse actually exists for 1/trillionth of a second. Can you imagine that?
Wow.
That's how fast this laser is. That's why it's called
Wow, that's faster
Pico.
than a blink of the eye, I tell you. I've got the old nanosecond laser, and boy, that's fast. I mean, that's a Lamborghini coming out of the chute.
Right, and that's a billionth of a second. This is 1/trillionth.
Yeah.
So what does that really mean in terms of treating tattoos? Well, it really allows us to treat these tattoos in about half the time it took for the old-fashioned lasers. And the other big benefit is that we can do it and treat colors that we couldn't even treat before as well. So it's really revolutionized how we can treat tattoos today, because as you know, when we treat a lot of different tattoos, it may take 6 or 8 or 10 treatments to get rid of them with the older lasers. But with the picosecond technology, we can really have the number of treatments and treat colors that we couldn't remove before.
That's revolutionary. You know, Bruce, when I started with tattoo removal, and you probably did too, we used to use a laser way back when that used to literally burn off a tattoo, and it used to cause hideous scars. You remember those days. We used to use
Absolutely.
a CO2 laser and just vaporize it, thinking that it would do a better job. Well, the scars were hideous, and they were just awful. Then we started getting into a process trying to figure out how the laser really interacted with the tattoo. And we came to the concept of Q switching. That was where we put a huge amount of energy into the laser, and it just literally gave all that energy in a very short pulse and literally just fractioned it. Now, those lasers had to be of certain colors, and certain colored light would interact with certain colors of the tattoo, breaking it down into small pieces so the body could absorb it. Now,
Exactly
what
right.
is exactly different with the picosecond laser?
Well, you've described it very well, Barry. What the picosecond laser does is basically shatter the tattoo ink into particles that are so much tinier than the ones we did achieve with the older lasers, and that allows the body to clear it faster through the lymph system, so that these particles now are basically dust. That's how fine they are from the picosecond technology. So that's why these tattoos go away a lot more quickly,
now,
and without scarring.
Picosecond laser do you need a different laser for each color, or can one laser do it?
No, one laser. It's 755 nanometer. That's the wavelength of the PicoSure technology, and it treats most of the color tattoos that we see today.
So the 755 nanometer, isn't that in the Alexandrite spectrum of light?
Absolutely. That's an Alexandrite laser, but, it's sort of the Ferrari of the Alexandrites.
Yes. So they've really fine-tuned this. Now, the first laser I ever got was an old laser. I think it was a MedLight. It was one of the early MedLights, I think a MedLight 1. And, it was great. And then I got a MedLight 3. And the first laser that I got of the MedLight 3 didn't work for 6 weeks in my office. It kept on breaking down. And this was a problem with a lot of the early tattoo lasers. I'd book cases. I'd have to cancel because the lasers would be broken. How is this technology, comparatively speaking?
Well, it's very stable. We've had the laser for a while. We haven't had any problems with it. And you're right to raise that issue because whenever you come across a new technology, it's like a new model of a car. They have to get the kinks out of it. But Cynosure, the company that actually makes the PicoSure technology, really tested this out a lot before they released it. And so far, I can tell you we haven't had one problem with it. So it's very stable, even though it's brand new technology.
Now let me ask you another question, because this has been the bane of all of us tattoo removals. It's been the blue, greens, and turquoise colors. They've been a bear to remove. I mean, every laser has said, they said the ruby laser would remove it. Yeah, right. They said the alexandrite laser would remove it. Well, sort of. Can you get the blue, greens, and turquoises out with the picosecond laser?
Absolutely, Barry. We can get out the aquas, the greens, the light blues. The reds still are a little bit difficult to remove, but the other colors seem to respond extremely well.
Interesting. So,
and without scarring,
we have a laser that can do
scars.
most things. Oh, wow, that's great. That's fascinating and really, really interesting. I came across the picosecond laser a couple of years ago. I looked at it and said, geez, I'm not sure if it's worth it, but you're telling me it is.
Yes, I mean, this is a new one that just came out in the last, I'd say, 6 months, 8 months.
Okay.
FDA approved. So, if you have a substantial tattoo practice, and we actually work with a very, I think, really exceptional group called Fresh Start. And what we do with Fresh Start, Barry, is we actually treat ex-criminals, ex-gang members who have tattoos on exposed areas, victims of the sex trade, and we do it for free. And the reason is because a lot of these people have these tattoos on their hands, their necks, their faces even, and it makes it very difficult for them to get a leg up in society, get a job again. And I think it's really an important cause, and that's why we participate in it.
Bruce, that really makes me happy. I started a similar program in Canada way back in the early 1990s, treating people like that, and I still do it even to this day. Some of the biggest and most grateful patients that I have are those that have been formerly living on the street, prostituting themselves, and now part of the reason that they're there is because of their tattoos. It sort of ties them there and emotionally binds them there. And it's the same thing with tattoos and gang members. If you had a tattoo and walked to the wrong side of New York City, you could die today.
That's true. Absolutely right.
I think it's an important thing to get these removed and allow these people to get back to a normal standard of living.
That's very true. And, it's interesting. We see all kinds of, tattoos, and the stories behind some of them are really pretty wild, I have to tell you. I had to tell you one quick story. Recently we had a fellow who came in, young guy, and he said, Doc, I want to have this tattoo on my arm removed. So I said, let me take a look at it. I looked at the tattoo, and it was one of the most beautiful crosses that I'd ever seen. Just incredible colors and just beautifully done. And I said, and it was, a big Roman Catholic cross on his arm. I said, well, why do you want to have this removed? So he said, because I'm Jewish.
Really? What did he get that done for?
I think he was just rebelling at the time, and, he was trying to send a message to his parents, so he got a tattoo of a cross. And as he got older, he decided it probably was not appropriate for him.
The most bizarre tattoo I ever saw was of a prisoner in jail that had a 8-ball tattooed to the top of his head. And I asked him about that, and he said, doctor, it's because I feel like an 8-ball every day, and that's why I got it done. Boy, he was certainly happy when he got that off. It was an amazing thing. So a lot of bizarre tattoos out there, and a lot of bizarre things that happen out there.
Well, I think we should write sort of a book sometime about the reason why some people put tattoos on their bodies. I'm sure it'll be very interesting.
It would be similar to Ripley's Believe It or Not. I think some people would not believe it rather than believe it.
Oh, yeah, absolutely. So, but I think, with this new technology, it's really revolutionized the way we can remove tattoos today,
Well,
and very
thank
quickly.
goodness, because these tattoo artists are coming up with more dyes than I can ever come up with solutions for. They are coming up with dyes faster and using all different colors and everything else. We really need one laser that can remove all of them, not having 20 lasers that'll remove them.
Yeah, no, I agree with you. But, I think this is a step in the right direction, so perhaps we're almost there.
Yeah, that's great. Well, this is Dr. Barry Leica. I'm talking to Dr. Bruce Katz of the Juba Skin and Laser Center of New York City. We just finished talking about tattoos and what's new in the removal of them. Now we're going to go into a new topic. It's a topic that really I think we're just verging on right now, and that's on skin tightening. There's a lot of buzz out there that you can actually tighten skin. And some days I think we can tighten skin, and other days when patients come back in, I don't believe we can tighten skin. I really have my ups and downs with this topic because some of our technology works some days and other days it doesn't, and I'm not exactly sure why yet. And it usually means we don't understand things. Bruce, what's your feeling on skin tightening right now?
Well, there are a variety of different technologies available. As you know, Barry, we have ultrasound, we have lasers to tighten the skin, and we have radio frequency. And, I think a lot of these do work to a certain extent. They're not home runs by any means, but the technology keeps getting better. The power of these devices increases. So I think we are making progress, and I think that's a good sign so far.
Yeah, and I think that's the buzzword is we are making progress. Every year we're getting a little closer with that. I really like what we're getting. Some of the tightening we're getting, I think, is because we're stimulating the body to produce collagen. And producing collagen has always been a difficult thing. When I treat some patients with liposuction and using lasers to tighten it, like the smart laser, I find that tightening does happen, but it's a very slow phenomenon. I find it takes 6 months roughly for it to occur. Do you find the same thing, Bruce?
Yes, I think you're absolutely right. Using smart lipo or other laser lipolysis devices, you're absolutely right, Barry. I mean, it takes time for new collagen to come in, and that's often several months, sometimes 6 to 8 months, depending upon the person. And the interesting thing also is we've found that people who've spent a lot of time in the sun really find it much more difficult to create that collagen. So they don't respond as well. So I think we also have to be very selective with the patients we treat and give them realistic expectations about what kind of results they will get.
Sure. Now, recently, and not so recently, actually, we've been using radio waves to help tighten the skin. One of the first one was Thermage, and Thermage would work so-so on the face. I found it actually worked better on the body than on the face and got better tightening on things like the abdomen and things like that. What are you finding new in the RF field?
Well, you're right. I think Thermage was really the first technology that showed results with skin tightening. There are other devices we've used, Excilis, which is another type of radio frequency, which works quite nicely as well. One of the newer ones we've been working with is a device called the V-Shape. V as in Victor shape. And what it does is it really has two different types of radio frequency. It has unipolar and bipolar. But I think the advance there is that it's a 300-watt machine. So this blows away everything else because it's so powerful. And it really allows us to tighten skin around the jowls.
Let me ask you a dumb question about that, Bruce. Powerful, in my mind, equates to pain. Like Thermage was a very powerful machine, but boy, I sure didn't like using it on people's faces because it was so painful. What do you find with this?
Well, the nice thing about this one is that it has real-time monitoring of the skin. So we can generate the energy very quickly, and before it becomes painful, we can see the temperature rising and reduce the output of the device. So it's sort of like a smart bomb. It hits very quickly, but before it gets really painful, it stops firing. So it's an interesting new approach to radio frequency. Nice thing about it also is you can treat any skin type, any skin color. So it's really colorblind in terms of treating all the different types of skin types. And we use it, for the jowls, the neck, the abdomen, upper arms, people get bat wing loosening of the skin.
Now, one machine I've been using in the last couple of years is Althera, which is focused ultrasound, and found really good results of that on the facial area because it actually goes and tightens at a level of something we call the SMAS, the superficial muscular aponeurotic system, the area underneath the skin that actually gets targeted where a person gets a facelift. Now, how does this machine compare with something like that?
Well, this goes pretty deeply as well. It'll go down to about 2.5 centimeters, depending upon the area that you're working in. But unipolar is a very, very deep technology. But it works differently from ultrasound, because ultrasound really creates these little hits of ultrasound energy throughout the area, whereas radio frequency causes more of a block heating effect. So it works differently, but I agree. I think all therapy does work quite nicely, too. I think it's only been used on the face and neck, though, right?
Yeah, that's the problem right now. Althera just hasn't gotten to the point that it can be used on the bat wings yet or the abdomen yet. But, as with all this stuff, all this technology is in evolution. It keeps changing and keeps on growing and keeps on going with when people say, I've tried this on this. Maybe we can develop this way. And, that's how all of our lasers have developed. That's how all of our tools have developed. And I suspect Althera is going to develop protocols like that. I'm not in on any of those, but knowing the company, knowing the president, knowing the people in it, they're always modifying things according to what people need to get done.
Oh, yes. And I think, a lot of companies are out there. This is sort of the holy grail still. Skin tightening, fat removal, cellulite. These are the areas today where a lot of the research and development is focused on because it's such a big problem for so many people, and particularly aging baby boomers.
Okay,
but it's also new technology as well.
Okay, will this replace the facelift, Bruce?
Well, Barry, in certain people, they still need to have a facelift.
Yeah.
They have so much excess skin, loose skin, and they have so much sun damage. There's no way that collagen is going to produce enough tightening to make a difference. But, a lot of younger people who are beginning to develop what, they call this the new tech neck. I don't know if you heard about that. Because everyone's looking down at their computers, their tablets, and their iPhones, they're realizing how loose the skin on their neck is, just from looking down all the time. So this is becoming a big problem and a big concern, and I think people are looking for solutions.
Interesting. So now we have a technique that'll work for the tech neck. I like that one.
Tech neck.
The technique for the tech neck. I like that
right.
one. That'll go over well. You always need some buzzwords in our business just to go over well.
Yes.
Technique for the tech neck. So let me ask you another question about this, and that is the big buzzword everybody's worried about in this day and age, and that's downtime. A facelift is great, but you can't get a facelift done and go back to work the next day. It takes time for the body to respond to it. It takes time for the body to heal. Even with the best techniques that are going out there, it still takes time. What about with these new RF machines?
Well, the great thing about them is that there's really no downtime at all.
Yeah.
That's really the remarkable thing. There are other technologies that do require a little downtime. There's a precision TX technology, which actually is a minimally invasive technique where we thread the laser fiber under the skin, very similar to laser lipolysis, but the energy actually shoots sideways on a laser fiber, so it actually can directly hit the undersurface of the skin and stimulate collagen.
Now,
That's
is
one
that
of the newest
the cellulase technology, or is similar to it?
It's similar to it. It's a variation on it, but it's been used now for skin tightening.
Interesting. Yeah, I found that the cellulase technology, when we're tightening things such as cellulite deposits, actually does better on stretch marks. I find it really, many people that have cellulite actually have some microscopic stretch marks when you look at it very carefully. And I think that's what we're targeting when we're actually doing some of these treatments. We're actually tightening that.
Oh, yeah. I mean, I think it does a lot there. Absolutely. So, it's really exciting to see, we have a new technology coming out, almost every 6 months at this point for either skin tightening, fat reduction, or cellulite.
Wow, that's the truth, isn't it? That every day there's something bigger, better coming out that's making a better role to play in people's lives, and really, really helping people do better, look better, feel better about themselves with less downtime than we ever thought possible.
Absolutely. And today, a lot of people don't want to do surgery, so they want to explore these options before even considering being cut. So that's why there's so much interest in these non-invasive or minimally invasive treatments, because if you can avoid surgery and get really decent results, why not?
Well, that's what I think is very important. Still surgery does have a role to play, and certainly we do have to consider that, especially as things go on.
Sure.
But I think the whole technique right now is people are getting things in such a way, they're getting them done quicker. They're getting them done at younger ages to try and prevent a lot of the stuff that comes out. And I think that really is the way modern science is going. And I think we're getting better at doing things like that, and people are starting to accept this more. That they're coming in their 20s and early 30s and saying, geez, my mother had a neck like this. I sure don't want to go that way. Mm-hmm. Is there anything you can do, doctor?
Absolutely. And I think another important thing for your listeners to remember is that they should go and shop around, and they should go to doctors who specialize in these technologies, who have multiple devices, and not just one technology that they really try to use on everyone, which really isn't effective. And, I know you have a great laser center and you do a lot of laser work. But if someone goes to a doctor that has only one laser for, say, fat reduction, and they want to treat cellulite or skin tightening, it's not going to work, and they're going to be wasting their money. So they really should shop and find really experienced laser surgeons to get the best results.
Well, there's an old saying, Bruce, if all you have is a nail, everything has a hammer. And all you have is a hammer, then everything's a nail. And
the world's a nail, right.
It doesn't go well like that in my world. I think you need a tool for everything that you possibly can. And the better the tool, the more fine the tool, works better for my patients.
Exactly. And, when people come in to see me and they've been elsewhere and they say, well, I tried this, I tried that, and it didn't work, what can you do for me, doc? And they're obviously disappointed and they're looking for a last resort. And when I asked them what they actually had treated, what they were treated with, first of all, a lot of people don't even know the names of the devices, which they should, because they should know what worked and what didn't work. But then if they go to another doctor, they want to make sure they're not going to be treated with the same thing again that didn't work. So, an educated consumer is really very important in terms of getting the best results for that consumer.
Yeah, I think that's very important. I think people have to realize that just like there are doctors with a lot of tools, there are doctors with different skills and different skill sets. And people have to look for doctors that have the right skill set for them. I find it amazing that some people only go to one doctor in this day and age and never shops around. I find it amazing that people will just listen to commercials and not find a doctor that has the requisite skills and not ask questions when they see them. Heaven forbid, to ask a question is something that a lot of people don't even think of. No, that should be something that everybody does.
No, I agree. And, today it's so easy to go online and go to the doctor's websites and find out what kind of tools they have and what kind of experience. And they should also continue to ask about that once they see the doctor and make sure that they have the right experience. So they're not just someone who took a weekend course and bought this laser or this radio frequency device and is trying to use it on everyone for everything. That's a real scary proposition.
That is truly scary, and it does happen. We've seen it.
Very often.
You've seen it. I've seen it. Then somehow they come to us to take care of the complications, which frequently is hard to do.
That's true. And there are a lot of doctors out there today who want to go into cosmetics because they're not happy with insurance, and they do this. And unfortunately, we see it more and more, and patients end up spending a lot of money on procedures that don't work for them, and then they think the technology is not good. But they don't realize they had the wrong technology treating them.
Absolutely. Well, Bruce, if anybody would like to get in touch with you, what's the best way for them to do so?
Well, you can go to our website, and that is www.drkatz, Juvaskin, JUVASKIN.com, juvaskin.com, or our phone number in New York is 212-688-5882, 212-688-5882.
Well, Bruce, I can't tell you how much I can thank you for the show tonight. It was, again, a lot of fun. We talked a lot about good things, and I'm sure our listeners have learned a lot.
Well, I always enjoy being with you and spending time, Barry, so hopefully we'll speak again soon.
Thanks. Take care.
Okay, you too.
Bye now.
Bye-bye.
Bye. Dr. Barry Leica here, host of Inside Cosmetic Surgery today, speaking with Dr. Bruce Katz of the Juva Skin Center in New York City. Beautiful center. You should check it out if you're in that area. Also, as you're checking around for information in the world, go to Amazon.com and check out my new ebooks. Just Google my name, Dr. Leica, Lycka. Check these out. They're amazing price of $2.99. You'll find a lot of information in there. Thanks. Have a great day. Bye for now.